study to actually put together the livability index. So she's going to talk about that. And let me just introduce Lara. Lara Campbell is an Associate State Director of Advocacy for the AARP Florida and lead of the state office work on health, long-term care, and livable community issues. So we are extremely happy to have you with us, Lara. Thank you so much.
Good afternoon. Thank you so much for having me here today. And yes, I am from St. Petersburg. I'm glad I am here. Yesterday was a little bit of an interesting ride over from the tropical storm that we're still getting. I am glad not to be there. My dog, I have a little chihuahua. So my boyfriend's in charge of taking her outside, and she requires the umbrella going completely over her while she's using the bathroom, or she won't go out. So thank you for having me here today. It's an honor to be here. I've enjoyed the conversation so far, and I look forward to talking to you about one of my most favorite subjects, livable communities. So to start off with, I'll tell you just a little bit about AARP. I know most of you probably heard of AARP as the insurance company, or you've heard about AARP because you've received mail. I know my brother started receiving his invitation to join the organization at 25, and he was less than pleased with me. But we do a lot of things here in Florida. We have 3 state offices, one in St. Pete where I work, one in Tallahassee, and one in Doral. And we work on initiatives from helping people figure out what's their next step in life, which is Life Reimagined, to providing caregiver tips, to prevention, fraud prevention tips with our Fraud Watch network. And when I started thinking about the presentation today, AARP is really closely associated with planning. Our founder, Dr. Percy Ethel, was a retired teacher and superintendent. And she was visiting one of her former teachers and found her teacher living in a chicken coop because that was all that she could afford. And so after that, Dr. Ethel, which is in the right-hand corner, formed Grey Gables in California, which is the first retirement community in the country. It is still in existence today. However, there are a few more men in the picture than there were in the first picture. And the bottom picture is of Dr. Ethel with President Eisenhower, and she is showing him a blueprint of the Freedom House, which is the first house that had features that we call universal design today. So thank you again for having me here. I'm going to start by playing a commercial, and we'll get back to livable communities here in a minute. But this commercial is a Christmas commercial from a German grocery store called Edeka, and if I'm saying that incorrect, I'm from South Carolina. So it will be nice to see a little bit of winter in the summertime. Please bear with me. The commercial is having some issues. Oh, good. Okay. So thank you so much. I know that was in a different language. So far it has over 48 million views. And even though it is in a different language and a different culture, the message resonates. And I do apologize for the tearjerker at the end of the day. I wasn't trying to see how many people I could make cry, but the message is a really strong one, and it's a dramatic illustration of 3 major issues that we need to address here in America. And the first one in the commercial highlights is that family is changing. In the video, the grandfather, Opa, was living alone and his children lived all over the world. They all had to fly to see him, and I don't know about everybody here, but that's pretty similar to my family. I'm from South Carolina, as I mentioned earlier. Everyone used to, 50 years ago, live within 50 miles of each other, right? But now we're all over the country as well, and I'm sure many of you have the same in your family here. If you also remember, all 3 of those children are married. However, only one of his children has children themselves. So that raises a few questions for the 2 couples who don't have children. Who will come to their Christmas dinner? And if we assume they don't ever have children, who's going to be their caregiver? So let's take a quick look at today's current caregiver. They're on average 49 years old. 3 out of 4 are juggling caregiving and a career. They are making a much longer commitment to caregiving than they have in the past, with at least 4 years on average. And the sandwich generation, which I'm sure there are a few people here that fall into that category, are taking care of their own children and their grandparents, or their parents. And to just give you a reference point, there are 2.6 million caregivers in Florida. So take that knowledge for a minute, and then let's look at the demographics, which I know everybody here already knows. We know that Florida is aging, and we know that Florida will continue to age. Generation X is turning 50 now, and the millennials, which I know we talked quite a bit about earlier today, they're the largest generation yet. Aging is the new normal. Florida and the rest of the U.S. are going to continue to age, and it is here to stay. So this leads to the first major issue that is highlighted in the commercial. We are facing a caregiving crisis because of the changing demographics and changes in the family structure. We know that boomers and subsequent generations are living longer, healthier, active lives, but there will be a time in their life where they will need help. And for the last 50 years or so, that help has come from family members or from institutional care, such as a nursing home. So we are talking about, and we see clearly in this commercial that family is changing. So how are we going to address that caregiving crisis? The second issue that I want to bring up is the plague of loneliness. Holidays in many cultures are key to family gatherings and socializing. You see Opa eating alone for Christmas, I think 2 times, while his next door neighbor is hosting, which I have a bone to pick with his neighbor. How can he host and not invite Opa over? This seems like a pretty dangerous level of isolation. And this is precisely where I started tearing up when I first watched the commercial and thought of my grandmother, who often spent her nights eating dinner alone as well. We are nature by social. By nature we are social. Loneliness is a bigger problem than simply an emotional experience. We know that loneliness and isolation are harmful to our health, and in a recent study, it shows that lacking social connection is comparable risk factor for early death as smoking 15 cigarettes a day. 15 cigarettes a day. And it is worse for us than well-known risk factors like obesity and physical inactivity. So this seems pretty grim, but what can we do to help reduce isolation and connect people in the community socially and for their healthcare needs, such as caregiving? If you remember, the commercial opens with Opa bringing his groceries up the stairs and his dog screening him, which is a great thing to have. Pets are wonderful for isolation as well. Opa can climb those stairs today, but what happens when he can't climb the stairs anymore? And imagine if Opa was able to walk to the grocery store with his neighbor, maybe not the neighbor that did not invite him over to eat dinner, but another neighbor, both the social interaction and physical activity would be beneficial for his health. And one way communities can get there are through active, engaged, interconnected, and intergenerational communities. And at AARP, we call that livable communities. This is just one definition that we have. I think that every department within AARP has a different definition for livable communities. But aging in place is accomplished through communities which includes complete street features, have safe and accessible buildings and outdoor spaces for people of all ages, and it facilitates independence and engagement of residents in civic and social life. And study after study overwhelmingly shows that older adults want to stay in their home and in their community for as long as possible. So in order to figure out what it is that older adults want in their community, our Public Policy Institute researched over 4,000 adults 50 and older and found a lot of what we're talking about today, that older adults want to be near their bus stop, their grocery store, their park, their church, and older adults want to participate in the economy. They want to get out, they want to buy goods, they want to be able to go to see their doctor. These are some great pictures that illustrate that. You see in the top left-hand photo, the woman is shopping at the grocery market. She's outside, it's an outdoor market. In the bottom picture, the gentleman has a basket on his bicycle. It looks like he's been shopping and he has items in his bicycle. Both of these residents are running their daily errands and getting exercise in the process. This is another example of a Florida crosswalk, and you can see that the couple is going through the crosswalk. It's very easy to distinguish from the road. There's a bus stop sign next to it, so we know that there are other transportation options. I don't see a chair for the bus stop or any covering from the shade, but that may be on the other side, hopefully. So today we've talked a lot about what millennials are interested in, but a lot of the same things that millennials want are the same things that boomers want, which is always interesting for me to talk about this because I fall on that cusp of I'm not sure if I'm millennial or if I fall into Generation X. But I talked to my friends and I heard someone say earlier today that the millennials and your friends want to have these same things. Well, when I'm talking to our members and boomers within AARP, these are the same things they want in their community as well. So we talked about this quite a bit earlier. How do you get there? I wanted to show you this slide. This is a document that AARP came out with last year, the livability economy, and it goes through different things that you can do in your economy to make it more livable. And then it also talks about how it is good for your economy as well. And I will give you some links to that towards the end of my presentation. And this one thing I wanted to highlight here is it shows that a walk score increase of 1 point can improve the value of a home as much as $3,000. So, we've discussed features of a livable community, but who is doing this well and how are our neighborhoods, cities, and counties doing? AARP developed the Livability Index justifying this out. We developed this with our Public Policy Institute, with a 30-member technical advisory committee, and this is the largest research project that we have done at AARP ever. The index measures 60 indicators spread across 7 categories of livability: housing, neighborhood, transportation, environment, health, engagement, and opportunity. So this is a sample result. If you go into the index and you can type in your neighborhood address, your zip code, your city, your county, your state, and it'll give you a score. So I have up here West Palm Beach, but it is pulling zip code 33401 for this particular one. I do want to point out before I start getting questions and hands raised, this 46 is not bad, okay? So before people start asking that question, The majority of communities in Florida and across the states average at 50. I believe only one community scores 70. So pretty much all communities in Florida are between 40 and 50. The category scores are presented on a scale of 0 to 100. So you can see here we have, and I'll go into this in a little bit more detail, but it goes from red to green. One other interesting thing, because I know we have a lot of data people here, you can go into this map layer and you can hold it constant for other factors, and you can pull a score based on one item in particular that you want to look at. You can also, sorry for the other side of the screen, you can also plus or minus, so you can extend and increase the map. And when you do that, you can see how the different colors show up here. That will also give you a score in the bottom corner. So there are a lot of different things that you can do. You can also print a copy of your entire report for your community. And like I said, each category is given a score ranging from 0 to 100, with housing, neighborhood, transportation, environment, health, engagement, and opportunity. And I will reiterate, 46 is not a bad score, 50 is average. The first time that we presented this index was actually in Florida, in Miami, and one of the communities that was present for the presentation was really upset because their engagement score was low, and they told us that their Tai Chi classes had a line going out the door. Why wasn't it higher? This is a national database, so we're unable to pull some of that small data, which I understand may look different in your community than it is showing up here, but this is a really good starting place to have a discussion. I'm going to go into a little bit more detail on this particular slide on engagement, which this West Palm for the 33401 got 57, which is extremely high score. And if you can see, it's broken down by different categories: internet access, civic engagement, social engagement, and then you get a score, a green, red, yellow, green, depending on how you did. And it tells you right next to that how we scored it. You can, if you want more information, you can click down and you can find the exact database where we pulled that data from. And we also have this, which I really enjoy, and I would appreciate any feedback if something is missing from your particular community. But we're also include policies and resources there. So for example, if you had complete streets policy in your community, it would show up there. If you have a smoking ban or anything like that would be included in some of those help change the score for your community. You can also compare multiple locations. So I compared the locations on my trip back from here. So I'll end up in Tampa. They had 40, Naples, and Fort Lauderdale. And you can see that you can actually compare communities based on one domain, like the housing or the neighborhood or the transportation. So you can pull down as much information as you want from that. And applying the data. So how can you use this data? So I know we've been talking a lot about talking to elected officials. This is one way that you could use this. If you want to show that you have housing needs in your community, then you could bring this data to just start a discussion and to supplement with your own data as well. It can also be used for advocates. I know a lot of our volunteers do walk audits in the community. We've done that quite a bit in Broward County. They will go and walk through a community to see if it has sidewalks, what features are there, but you could use that in addition to this to talk about the need for more complete streets or more parks or things like that. So this is the home page, and you can see here that you can put your address, your city, county, or state address. This is the website, AARP.org/livability index. You can just Google it and it'll pop up as well. So making the connection, we have our index, and something that AARP is trying to figure out to go back to OPA. Now we know how the communities look, how they're doing, but what can we do, how can we improve them, and how can we get there? In answer to that, AARP joined the AARP network of age-friendly communities in 2012, and we're in partnership with the World Health Organization's initiative. So this is a global initiative. This map is out of date. It has grown tremendously since the last time they have pulled this. In fact, the entire country of Ireland is now age-friendly. I think they have 2 different districts that are still working there, but the rest of Ireland has made an effort to become age-friendly. And this is a map of the United States, which was updated in March 2016. In 2012, AARP started with 10 pilot communities, and since then we have grown to over 81 communities with more than 44 million constituents where we're doing this work. I am proud to announce that since this slide's outdated as well, I apologize, but as of March 2016, Florida has another community that's joined. Our first community was Sarasota County, then the city of Tallahassee, the city of Winter Haven, the city of the town of Cutler Bay, and just recently Hallandale Beach and Broward County has now joined. So what is this age-friendly network? What we're doing is these communities are targeting these 8 domains of livability listed here that influence the health and quality of life for older adults. It's based on the built environment, which is exactly what we were talking about today, housing, transportation, outdoor spaces, the social environment, volunteerism, work opportunities, respect, social participation, and then cross-cutting issues like healthcare and access to information. When we first started working on this, I know I looked at communication, I was like, oh, well, we need to make sure everybody can still get information if they're not connected online. But as I've been talking to different communities across the state, communication is one of the biggest issues because we have so many wonderful resources in our community, but a lot of people still don't know that they exist. So I know most of the communities that are doing this work, that is a big push that they have. And to quickly, I could spend probably an hour on this slide as well, but to quickly go through this is the process of joining the network. The first phase is making sure that you have support from your elected officials, you have a group of stakeholders that are interested in doing the work, and then you sign up and sign the application. And then you enter step 2, which is 2 years. All of the communities in Florida are in step 2 now. That means that they start by surveying their residents to find out what's working well in their community, what may need improvement. We already have our survey results back in Tallahassee, and we know that housing, transportation, healthcare, health and wellness is something that they're going to be focusing on in Tallahassee. We have some results back in Sarasota, which they're going to start releasing shortly. And once people have those results, then they develop their plan. And when I say develop their plan, a lot of times it's when you're going to redo your city work, such as retrofitting your streets, that you're taking into account complete street ideas when you're doing that. Some communities, one of my favorite low-cost examples is New York City, heard from the residents that they were scared to swim in the local pools because of all the children, and they were afraid that they might get injured. So citywide, New York City makes an hour a day set aside so that older adults can swim in their pools by themselves, and they don't have to worry about having anybody else, and they don't have to worry about falling. So that is something really simple that you can do. In DC, they started age-friendly businesses. So they receive a designation to say that that particular restaurant maybe has brighter lighting, larger font, but they're keeping in mind who the people are coming into their restaurants. And so once you do this planning, decide what you're going to do. Step 3 is implementing, evaluating, and then at the end of the 5-year time period, you go back and see what's worked, what you might still need to improve on, but it's very cyclical. So you continue to go back and do this. You can go online at AARP and see all these 81 communities that have signed up. We have their survey results, their plans. You can look at different slideshows of best practices. For example, Wichita, Kansas developed a really cool grandparents park so that the grandparents are getting exercise while their grandchildren are there. And they talked about the entire process, how they did the survey, and then they went back and talked to their city officials and really advocated for this park. And to tie that back into the livability index, we specifically look at items like parks and how close you are to the park. So if a community built a new park or redesigned it so that it was geared towards older adults, that would increase your livability score. And here are some pictures of the work that's going on in Tallahassee, going across the state. This first picture is in Tallahassee, the mayor receiving a designation that Tallahassee has entered the Age-Friendly Network. And you'll see the other two pictures are Dr. Kathy Black. She is the lead she's the lead person on the Sarasota Age-Friendly Initiative. And this year she went to Geneva at the World Health Organization's annual conference and talked to them about the work that's happening in Sarasota and across the state. She's talked to people all over the state of Florida, all over the U.S., and has been presenting all over the U.S. and internationally on the efforts happening here on the ground. So I've gone over a lot of information. What's more overwhelming than that is AARP's website. We have AARP.org/livable. It was intended for planners, for government officials, for people that are working in the community to give you some great resources. You'll see here we have blogs, fact sheets, interviews, livable lessons, everything I mentioned today. You can link up to that website. You can also sign up to receive our newsletter, which will provide you highlights of different things happening in the community. Secretary Billy Hadaway, who helped us develop our Complete Streets policy, is going to be highlighted in July in that newsletter. So I am here to take any of your questions. I know one question I always receive from people when I give the presentation. Lots of questions about the livability index. I'll be sure to try to answer those to the best of my knowledge and connect you with the right people. And then if you want to know more about joining the Age-Friendly Network in your community, let me know. I have an excellent volunteer leader here, and I wish he's vacationing, but I wish he was here. His name is Ken Reinhardt, and he's been going around to different communities in Broward and in Palm Beach talking about what we're doing in AARP, and I know he would be glad to come meet with anybody if you want more information. Thank you.
Thank you so much, Lara.